I'm going to go over to, I think, Bianca as well. You still there?
Hi, yes, I'm still here.
Great, great. Well, welcome to Rehab Power Hour. Would you mind just introducing yourself and tell me who you are, where you're calling from?
My name is Mianka, and I'm calling from Tulsa, Oklahoma.
Great. Okay. Well, so what can I do to be helpful for you today?
Well, I don't know. I'm really more interested in this machine. I um, I had strokes at the age of 18 while I was
Okay.
pregnant with my daughter,
Okay.
and I had transverse myelitis, so I had three
Okay.
strokes at uh, two blood clots on my brain and one on my spine, and the one on my spine caused the injury to paralyze me for a couple of months. And so I was like in and out of the hospital, and then I went to therapy down in Texas, and it was great therapy. And then it's like, as soon as I left and came to Oklahoma, they didn't do everything that they did in Texas for me. And so
Hmm.
it really took a toll on my body. And it's like, I feel like I was going back into the stage of being paralyzed because I wasn't really using my right side like that because my left side is good, but my right side is very weak. And so I was just hoping that this machine could help me
Sure.
get to what I used to be.
Yeah, of course. So it sounds like you have some backup there too. You have your kids there with you?
Yes, they're all
Great,
three here.
great. Very good. Yeah. Well, it's good you got some family support there. Hopefully, they're going to be motivating for you on your path of recovery. I'm glad they're there. Um, so, a couple of things I want to just ask really quickly. Is the transverse myelitis, or is that all resolved now, or is it still progressing, or are you fully recovered from that?
Well, I'm not fully recovered, but
Okay.
I can do a lot more than what I could. Like when I got
Okay.
out the hospital, I couldn't really walk. I had to use a cane, well,
Okay.
from the wheelchair because the wheelchair couldn't fit in the house, so I had to use a cane. And then I was crawling, and so I really have gotten better from there. And I can do everything now. I can cook, clean, and drive a
Great.
car. It's just like the little things is hard to do, like holding on to things and uh,
Yep.
opening and
Yep.
closing my right hand. And
So it sounds like most of your limitations right now are primarily restricted to that right upper extremity. Is that correct?
yes.
Okay. Okay. So yeah, good background. I appreciate that insight into you. It always helps me sort of frame a discussion when I know something about the individual I'm speaking with. So I very much appreciate you sharing that with me, and also your experience with your rehab. I think that's really, really typical, I'd say, when you find yourself in an inpatient setting, particularly in a good rehab hospital. It sounds like you had in Texas, and that transition from inpatient, where you have a lot of resources around you, a lot of individuals that are supporting you and making sure you're adherence to those really intense programs. All of those things change as soon as you get discharged and you find yourself in the home environment, and that's a big step off. And not least of which because the amount of rehab is significantly lowered, right? You might have, I don't know about you, but oftentimes in inpatient rehab, you might have 3 hours of rehab a day. You might have an hour of PTOT and an hour of speech. And when you find yourself in the outpatient setting, that might get cut in half at best, where you might be having a couple hours, maybe 3 times a week. And so that big step off not only is challenging because the dose is lower, but then you have sort of a lot of barriers that get put up in place for you not to achieve those levels of recovery. And then, of course, it becomes even compounded more when the continuation of your reimbursable services is dependent on your progress, but they're delivering insufficient amounts of rehab to see those progresses. So
Right.
it's kind of a vicious cycle. So it sounds like that's kind of been your experience. Am I kind of getting that right?
Yes, for the past 9 years now.
Okay, yeah. Have you been kind of in and out of outpatient rehab at this point?
I have not been back to rehab since 2012.
Okay,
And I've been I tried to go to inpatient, outpatient things here in Tulsa, but they're not used to dealing with somebody my age. They were only used
Sure,
to older people, and so they
sure.
couldn't really help me the way that I needed the help.
Yeah,
And um,
yeah,
they would
yeah.
send me
And
home with like pieces of paper to go do, and
yep.
wouldn't help.
Yep, yep. And that's a challenge, right? Especially when you have younger survivors of neurologic injury, especially complex neurologic injuries. Oftentimes, the experience is not there to know how to modify traditional types of protocols to help people improve. And so, I think it's really good that you're reaching out, looking at for sort of innovative approaches that can help. And the Motus hand is one of these types of treatment approaches that is designed to help deliver those high doses of what we call repetitive task practice. And these are what we call kind of the best sort of gold standards for neurologic recovery. And they're inspired off of a type of therapy called constraint induced movement approaches, or CIMT, or constraint programs. And these are the types of therapy that if we, personally, if we had kind of unlimited resources, every individual who survived a stroke or a traumatic brain injury would get something like this. But there's a lot of limitations to that. There's a lot of challenges. And so to overcome those challenges, the resources, just lack of providers, these sorts of things, the robotic systems can step in to really help provide that high level of care. And that's really the sort of underpinnings of the Motus hand, right? It is designed to help work on distal upper extremity motor function. So it sounds like that's kind of where most of your limitations are. And it is conditioned on trying to help individuals improve those functions. And so there's been a long, sort of about 20-year experience of clinical trials and development that we have leveraged to then develop what we have right now. And so that's kind of the background and its intent. And there's been a lot of evidence to show that it is helpful for individuals who are also chronic survivors who have chronic impairments. And that's something that I don't know if you've been told, but oftentimes people who are maybe greater than a year post-stroke say, okay, their neurologists or their physicians say, hey, what you have at 1 year is kind of what you have, deal with it. And that is A, quite discouraging, and B, patently false, because we know that rates of recovery, while they do kind of slow down as you go from your injury, they do not go to zero, right? People can still make meaningful improvement many years or decades after their injury, provided we deliver adequate, what I call adequate stimulus, or an adequately strong therapeutic intervention. And those are becoming increasingly hard to do in our classic sort of delivery mode. And that's why robotics are great. They can kind of step in and help sort of do some of the heavy lifting there.
Yeah, it was actually a robotic machine that brought my hands kind of back to life because they were first ball done. And I had shock treatments done and it shocked my hands and it brought it back. That's how my left side came back. But my right side like kind of rejected it. So kind of still to this day, I drag my leg a little bit and I don't like that. I hate it and it feels like a dead weight and it's too heavy to pick up. And it's like I'm trying to pick my leg up and I fall like a lot. And it's just I don't want to be like this anymore. I'm just still not used to this.
Yeah, and I think oftentimes it really depends on what specifically that intervention is. Sometimes we find ourselves more responsive to one type of treatment as opposed to another. So I think it is very sort of typical, I'd say, to have these kind of variable responses. And of course, there's maybe unique factors about you and your injuries, right? Having the strokes and the myelitis that might also interact, that might mean that one of them is more receptive to a various intervention and the other is not. And I will draw a distinction here and say that the Motus hand and the Motus foot do not rely on stimulus-based approaches, right? They're not exogenous electrical stimulation. They rely on trying to get you to have the independent control of your limbs again. And the way it does this is it actually encourages you to become personally engaged, intrinsically engaged in the activities. And so while the robotic system can help you move, either initiate movements or amplify your movements, it ultimately is going to rely on you to independently control those systems. And as you progress and as you begin to get more volitional activation, it will slowly take away that assistance and allow you to become more independent. That's that kind of the ultimate goal there. So I think it maybe is a different approach than what you've experienced before, because it's not relying on those sort of stimulation-based techniques.
Yeah, that sounds pretty much it.
Sure. Yeah. Well, any other questions for me?
Um, I don't know, not any that I can think of right now.
Okay.
I just been looking up all types of information on this machine.
Sure.
I'm very
Sure.
interested.
Yeah, and also one the other things too that's really quite nice is that it sounds like you're a busy mom, and the fact that it can be used in your home is a rather significant advantage that kind of sets it apart from other types of we'll call them robotic-based approaches. And we spent the better part of probably 5 to 7 years testing and validating its use in the home. It's a very different thing to be in the clinic, right? Because you have clinicians there that can help you do things, but it's another thing entirely to see if it works in the home environment when you don't necessarily have all that backup. And we learned a lot through those series of clinical trials, and again, validated its efficacy and safety profiles for use in the home. And that will also help do two things. One, it's also more convenient, but it also, by nature of being more convenient, helps you have access to more care, right? Because one of those fundamental drivers is the amount of repetitions that you can do, the amount of active rehab you can do. If you have it in your home, you don't have to rely on scheduling a specific hour or multiple hours in a clinic, right? You can do it at your convenience, and you can accommodate your unique physiology. And oftentimes people will do multiple sessions a day to accommodate different levels of fatigue and experience. So that's also kind of a unique advantage.
That's awesome to hear, because taking them to the therapy place with me is chaos. It's absolute
Yeah.
chaos.
Yep. And everything looks like something to play on when you're in a PT or OT clinic, right? It all just looks
Yes,
like toys.
they're playing on
So
the medicine balls and
yep.
throwing some of the equipment at each other, and it's like, let me try to sit down somewhere. But they were so
Yep.
young, so I expected that. But it was like, I just really can't do this. And it's like it was hard for someone to come out to my house as well, which I didn't understand that. I wasn't approved
Hmm.
for the specialist to come to my house and help me.
Yep.
But they gave me like 2 weeks of therapy, and that doesn't help anybody. 2 weeks is nothing
Yeah.
to a stroke patient.
Yeah. Oh yeah. I mean, this is one of the classic challenges here, right? I mean, and anyone with any sort of insight will look at the system as it's designed and realize that the way that reimbursable services for skilled therapy services are reimbursed now is conditioned purely off of the orthopedic model, right? It is not based on trying to help individuals with neurologic injuries recover their maximum capacities, right? It just, those two things are incongruent. And so it is no surprise that when individuals are given 2 weeks of PT or OT, if they have a stroke, you're not going to make progress. It's plain and simple. It's not going to happen. And
Yeah,
in those
it didn't
cases,
either.
yeah, and of course, what then they say, well, we'll give you more rehab if you progress, and it's like, well, that's great, but in those time frames, it doesn't appreciate the fact that neuro rehab can be quite protracted. It can take a long time to see measurable improvements, and if you don't have time to see the changes, then of course you're going to get discharged due to lack of progress. So it's an unfortunate situation we find ourselves in the U.S. healthcare system. But this is one of the reasons why we get up in the morning every day and try to do the best we can to help serve survivors of neurologic injury. So we're trying our best here. So
I really appreciate you for this. Like, I wish I found you sooner.
yeah, and many people ask, well, why haven't I heard about you guys if you've been around since early 2000s? And the truth of the matter is it takes a long time to do all the scientific studies and demonstrate whether or not we have the safety and the efficacy data to justify putting it out there, right? We're not going to preempt things in terms of before they're ready. And right now that we have those bits of evidence in place, and we have great confidence in the systems, now we can get the word out and have confidence that it's going to help this large population of individuals who need help. So, yeah.
I can completely understand all the machines that I seen at the place is called Tier, and it's in
Okay.
the
Yeah.
middle of it's in the middle of the
Yep.
medical center in
Yep.
Texas, and I was there for a couple of months, and all the machines that they had was just like great. Everything helped. They even
Hmm.
helped me start walking again, and it was great.
Yep.
And then it's like when I left, everything just went downhill. And so I know it takes time for things to like get in line. And I completely understand. I mean, I haven't heard about you guys, but I'm interested.
Yeah. Well, Bianca, I very much appreciate our conversation today. And I think if you have any more questions, you are always welcome to come back. And I encourage you to join the support group. Even if you don't go forward with using the systems, so there's a great group of people there who all support each other in their path to neurological recovery. And I'm there. I'll be trying my best to answer all the questions. So I very much encourage you to utilize those resources that are available. And if you do decide to go forward with one of the systems, I would very much like the opportunity to work with you to do an assessment early on such that we can get you off the right path as soon as possible.
That'd be great. Thank you so much for the invite, too.
Yeah, of course. Very good. It was great chatting with you. I hope you have a relatively relaxing rest of your day with your family, but it sounds like it might not be such a relaxing time with all the kids. But
Oh, they
hope you
chilled
have
out
a
now. It's the snack
yeah.
hour. So
Okay, snack hour. Very good. Well, all right. Thanks so much for your time. I appreciate it.
have a good one.
Okay. Okay. Bye for now.